Hello, my name is Kayla, and I'm a registered dietitian nutritionist at San Antonio Regional Hospital. This presentation includes some general tips on practicing proper food safety habits to help reduce the risk of foodborne illness and help keep you healthy. Food safety is important and often overlooked. Cancer treatment can weaken a person's immunity and increase susceptibility to foodborne illness. If your immune system is especially weak due to low white blood cell count or neutropenia, you may have to be even more strict since your immune system is already weakened. Food safety is especially important before and after starting chemotherapy. The signs and symptoms of foodborne illness range from upset stomach, fever, abdominal cramps, vomiting, diarrhea, and dehydration to more severe illness. The pink booklet shown above is a wonderful resource. I have attached a link to a similar downloadable booklet from the Food and Drug Administration. The CDC recommends 4 steps to food safety: clean, separate, cook, and chill. Check out the CDC website at the bottom of the page for more information. Now we will discuss each in greater detail, starting with clean. The number one way to prevent foodborne illness is washing your hands. Be sure to wash your hands before and after preparing or handling foods, and again before eating. The CDC recommends scrubbing your hands for at least 20 seconds before rinsing under clean water. Commercial produce rinses and bleach solutions are not needed for produce. You can simply wash produce under running water and scrub with a vegetable brush. It is also a good idea to re-rinse produce that is marked as pre-washed, such as bagged salads. Be sure to wash the tops of canned foods before opening to avoid introducing bacteria when you open the can. Maintain a clean kitchen. Be sure to wash all utensils, cutting boards, and countertops with hot soapy water. The next step is separate. Separate means separating raw meats and poultry from other ready-to-eat food to avoid cross-contamination. Avoid putting a utensil you've already used back into a larger container. Instead, use a clean utensil every time you want to taste a food you are cooking. Another tip is using separate cutting boards for different items. For example, have one cutting board that you use only for poultry, another for red meat, and a separate cutting board for fresh fruits and vegetables. When you are shopping at the grocery store or market, try to choose produce that isn't bruised or damaged. Keep pre-cut fruits and vegetables cold by choosing produce that is refrigerated or kept on ice. If you are shopping on a warm day, consider bringing a cooler bag for safe storage on the way home. Pick up refrigerated or frozen foods just before checkout. Separate fruits and vegetables from raw meat, poultry, and seafood in your shopping cart and again in your grocery bags to avoid cross-contamination. As soon as you get home, wash your hands. After you have finished putting all of your groceries away, wash your hands again. Wash all food preparation surfaces, including cutting boards, countertops, and kitchen utensils before and after preparing fruits and vegetables or other ready-to-eat foods. As mentioned before, wash or scrub fruits and vegetables under running water even if you do not plan to eat the peel, so that dirt and germs on the surface do not get inside when you cut them. Cut away any damaged or bruised areas before preparing or eating. Dry fruits or vegetables with a clean paper towel prior to storage, then chill prepared produce in a clean container at 40 degrees Fahrenheit or colder. Lastly, keep fruits and vegetables separate from raw foods from animals such as meat, poultry, and seafood, as seen in the photo above. Ready-to-eat foods such as fruits and vegetables should be stored on higher shelves, while raw meats, poultry, and seafood should be stored on lower shelves to avoid cross-contamination. The next topic is cook. As you can see in the image, we want to cook foods to the appropriate temperatures to stay out of the temperature danger zone. The temperature danger zone is between 40 to 140 degrees Fahrenheit. This is called the danger zone because it is the temperature where bacteria grow the best and can multiply rapidly. You'll notice that room temperature is within the temperature danger zone. Never leave perishable food out for more than 2 hours. In fact, if it's hotter than 90 degrees Fahrenheit outside, food may only be at room temperature for 1 hour. Time temperature abuse happens when food is cooked to the wrong internal temperature, food is held at the wrong temperature, or if food is cooled or reheated incorrectly. Use a food thermometer to check that foods have reached the proper temperatures. Avoid eating foods that contain raw or undercooked eggs, seafood, poultry, or meat. Please cook foods to the temperatures shown above. It is important to mention that eggs and flour are not safe to eat unless they are fully cooked, so raw cookie dough and batters containing these items should be avoided. If you use a microwave to cook your foods, be sure to rotate or stir food to promote even cooking. Always follow the instructions on the package. Now we will discuss the chill component of food safety. As previously mentioned, bacteria grows fastest in the temperature danger zone between 40 and 140 degrees Fahrenheit. Therefore, it is important that your refrigerator is set to 40 degrees or below so that food is chilled appropriately. Remember, refrigerate foods within 2 hours. Freezing, however, does not destroy harmful bacteria. It just keeps food safe until you are able to cook it. Since the goal is to get foods out of the temperature danger zone, or below 40 degrees, within 2 hours, a good tip is to place foods into shallow containers before refrigerating so that they will cool faster due to increased surface area. As mentioned before, consider bringing a cooler bag with you to the grocery store to keep cold foods cold during transport home. On the opposite end of chilling is thawing. Thawing foods in the refrigerator is the preferred method of thawing since refrigerator temperature should be below 40 degrees, which is out of the temperature danger zone. Make sure you place food on a dish to catch any drips and prevent contaminating other foods. If submerging food in cold water to defrost, be sure to thaw in cold running water and choose small cuts of meat so that they can defrost evenly without coming to room temperature, aka the danger zone. If using a microwave to defrost, use the defrost setting or select 50% power. Only use the microwave method if you are planning on cooking foods immediately after thawing, as foods may begin cooking if using this method. Patients often ask me about leftovers. When undergoing treatment, I recommend giving your leftovers to others and opting for fresh meals whenever possible. When we think about leftovers, there are many opportunities for improper handling which could introduce bacteria into food. I would also like to advise against tasting food that looks or smells strange, or foods that have passed the sell-by use-by date. These foods may be spoiled. By tasting the food to see if it is still good, we could potentially introduce the bacteria into our body and make you sick, even though it might not look or smell strange. If your immune system is compromised, it is better to live by the motto, when in doubt, throw it out. Be sure to throw food out before harmful bacteria can grow. Know when to throw out food by looking up safe storage times for individual items. Foodsafety.gov has a handy app to help you identify how to safely store leftovers. You can Google FoodKeeper app and use it over the internet, or download the USDA FoodKeeper app onto your smart device. In this example, I searched for pizza and selected leftover pizza. This lets us know that leftover pizza will be safe for 3 to 4 days if refrigerated and handled properly, and up to 1 to 2 months if frozen the same day it was purchased. The app will also tell you the safe minimum temperature to cook meats, poultry, and fish if you forget. A few more tips include throwing away eggs with cracks and avoiding unpasteurized juices due to potential for bacteria. Unrefrigerated cream or custard containing baked goods may have been stored at room temperature for long periods of time, which would make them unsafe. Lastly, Avoid eating at a deli, self-serve bulk containers, condiment dispensers, and soft-serve yogurt or ice cream machines, as these items may not have been held at appropriate temperatures or may have been handled unsafely. To summarize, food safety is important to prevent exposure to bacteria. The goal is to handle food properly and keep food out of the temperature danger zone to help keep you safe. The 4 methods of food safety include 1. Cleaning, which includes washing hands and surfaces often. 2. Separating raw meats and poultry from ready-to-eat food. 3. Cooking foods to the correct temperatures. 4. Chilling raw meats, poultry, cooked leftovers, and other ready-to-eat foods promptly. For more information, please check out the resources linked with this video.